Our project, Local Health System Sustainability Project, helps the government of Ukraine to develop a sustainable, effective, accountable, and resilient healthcare system leveraging telemedicine. So we are helping the government to not only to address immediate needs. Of course, there are kind of emergency needs of the population to restore critical health services, and it is humanitarian disaster actually. And we are trying to use telemedicine solutions to help people because they kind of lost access to those services actually, because we have, for example, more than 7 million refugees and 6 million internally displaced persons. So they just lost their connection with health providers. And so we are helping the government, the Ministry of Health, to use teleconsultations, telemedicine solutions to restore these critical services for the population. The biggest challenge, I think, it's the Russian attacks, actually. It's the permanent danger that people in Ukraine are living. And the health system actually is totally impacted by this Russian invasion, because more than 1,000 healthcare facilities were targeted by the Russian strikes, missile strikes and bombs. And out of them, more than 140 healthcare facilities were totally destroyed. Over 60 medical staff were killed or injured. So that's the huge kind of impact on the healthcare system. And to restore it, and just for to keep it viable and resilient, to continue providing services for population, that's the biggest challenge. And of course, we are working with with doctors, with health providers, and trying kind of to train them to use teleconsultations, telemedicine solutions. But they are overloaded actually, and they are endangered all the time. So, but anyway, we are breaking the ice and showing that such solutions could help the people and could be flexible instruments for the doctors to provide those services. Even in the condition of the conflict, of the war, we should think of the population. We should think of people, to how they could get access to the healthcare services. So doesn't matter what kind of conflict, what kind of disaster, what kind of crisis you are in, you should have the solution for that. And the system, the healthcare system should be resilient enough to respond, to overcome, and to resist to such kind of challenges.